Hello, my name is Dr. Ayush, and today we will discuss a most important topic in the surgery, in the adult surgery, that is gallbladder stone disease that happens in the right hypochondrium. So let's get started with the cholelithiasis. So if we will segment this word, if we will like break these words into two, chole means gallbladder and the lithiasis means inflammation due to stones. Okay, so there are two type of different stones are present. Cholesterol, that is yellow in color. How we will remember it? Cholesterol is generally fat. Fat is butter. Amul butter is yellow in color. Okay, and there is pigmented. Pigmented, there is generally no color. We cannot say that there is a fixed color for pigmented. They can be either black, gray, green, or it can vary also in different colors. Also, it can be muddy yellow and all that. Here are some images which I have put for you guys to see. This is cholesterol one and these are the pigmented one. Okay, so remember that in cholesterol one we have to remember 4F, that is fat female 40 fertile. Again, fat female 40 fertile. It means a female who is generally a 40 year of age, she is fat also and she is fertile. She will be having a high risk of having polylithiasis, a stone formation in this age. Okay, remember that the cholesterol one, the cholesterol stone will be more prominently seen of a patient having a disease of terminal ileum. And what are those disease? There are two such disease such as TB of intestine and Crohn's disease. Okay, remember terminal ileum, TB of intestine, or Crohn's disease. Okay, and in the pigmented, generally people having अपना anemia wala story, hereditary spherocytosis. You remember guys, enchiridion and all that effect, and sickle cell anemia can also be where there is a glutamine to valine shifting, and bacteria and parasitic infection also can be associated. But these are like some of the important things which you need to remember, just not a big problem. Now we will discuss about the case scenarios. There are generally three type of case scenarios. The first case scenario is the patient are symptomatic. Asymptomatic. So what are these? These are those patients who have came to OPD for another problem, another reason, but that radiologists accidentally discover these pathologies. So I can give you a clear cut case scenario, like a very common case scenario that a woman came to an gynecologist complaining about she's having a pain in the pubic area, and their gynecologist suggests that she's having some PID and started to like to decide this. He prescribed prescribed her about the ultrasonography, but accidentally, like radiologist done that ultrasonography in abdomen also, and we have found some stones in that there also. So what are the what are the clinical presentation? The patient will not come to you. Either patient even don't know about this condition. It is an accidental discovery, no? But remember, if you get discovered and the patient is pregnant, then the treatment you have to treat the patient. If the patient having stone more than 3 centimeter, then you have to treat the patient. If the patient having multiple stone, then you have to treat the patient. And if the patient is very elder, you have to treat the patient. And what is procylene of gallbladder? Procylene of gallbladder means that there is a calcium. Generally, in gallbladder, there is no calcium deposition. But if the calcium is deposited in the gallbladder, it is highly suggestive of risk of cancer. So we should remove this calculi. We should remove this stone. Okay. And also the immunocompromised patient also. We have to perform the surgery, and the surgery will be cholecystectomy. And generally we prefer laparoscopic. So we can call it in a short form as a lap chole. Patient presented in OPD. This is a case scenario number two, and more prominently, this type of patient are coming to us. Patient is presented in the OPD, and what is the suggested? Like patient is coming with a mild pain in the right upper abdomen, that is like comes and goes, like it resolve itself and comes again. Okay, but remember, upper abdomen or right hypochondrium is very important. Investigation of choice will be always ultrasonography. I will tell you why. In the case of all type of gallstones, the reason because when we will do the ultrasonography, it have the rays which can pass through all the organ, but it will never pass through any stone or any calculi. Okay, so remember these are the normal gallbladder. As you can see, these are the normal gallbladder, and there is no blackness, no darkness in this. But here is a stone. Okay, here is a stone in the gallbladder, and you can see a posterior acoustic shadow. You can see this posterior acoustic shadow. So this how this we can figure it out like this is a clear-cut case of a gallstone. Okay, treatment of choice for the patient who is presented in the OPD with acute pain, okay, but acute mild pain which comes and goes itself, okay, that will be laparoscopic cholecystectomy. Remember, four ports are inserted, four holes are created, four ports are inserted, and the various needle is used to create pneumoperitoneum, and CO2 gas is used to create this the various through the various needle we will create a pneumoperitoneum, and CO2 gas is used generally. The third patient, this is a clear-cut emergency case scenario, and how patient will be present to us. The patient will have a sudden severe right hypochondrium or right upper quadrant pain. Okay, which will radiate to the right side tip of the scapula. It will come like this. Is if this is a patient, he is having a right side upper abdomen pain, na, upper quadrant pain. This will radiate from the right side only towards the right scapula, and to the tip of scapula we will see the patient is having a pain, and sometimes it can even radiate till right side of shoulder also. Okay, so this condition will look like MI, but it's a completely different story than MI. Why? What is the reason of this emergency department? The reason is there is a large stone obstruction at the mouth of gallbladder. We will see this stone. This stone have came to the mouth of gallbladder or cystic duct. Okay, that's why a patient is presenting like this. Okay, and when there is obstruction, a person will start to have a stasis mucus with large amount of mucus will be present in his gallbladder, and the mucus there the gallbladder will be very over stuffed stasis, party हो जाएगी bacteria की. It will be very red, hot, inflamed. Okay, remember the patient will have Murphy sign because of mucosal. Large amount of mucus is stored in the gall gallbladder. Na gallbladder will be very rigid, hot. If the patient will touch, if the doctor will touch, if the patient will either touch, then patient will start to feel pain. So what Murphy sign will be positive. Murphy sign is positive in acute cholecystitis also. Remember, this is case of acute calculus cholecystitis. There can be different type of cholecystitis, but this is a case of calculus, means stone. Due to stone, there is a cholecystitis. So Murphy sign will be positive. What is Murphy sign? We will when we will palpate the abdomen, we should start from every time from the non-pathological part, that is from the left side. We will start from the inguinal area, then we will come up, and then we will go to the right side. Okay, and whenever the we will drag our fingers inside the rib, the patient, and we will say to patient to take a deep breath. Then again, suddenly the patient will catch his breath, and like they will be very painful. Patient will feel very pain. So, investigation choice, I've already told you in all cases of gallstone pathologies of stone, we should do for ultrasonography of abdomen. Conservative treatment will be done first of all, and then we will go for surgery. Remember, conservative first and then surgery. In this surgery, we will go for interval cholecystectomy. Conservative one, first of all, the patient will come. Patient is having maybe loss of consciousness also present. Maybe patient will having diarrhea, vomiting, nausea. So there is dehydration. We will go for IV fluid. Then we will go for IV antibiotic because cholecystitis, inflammation of inflammation of gallbladder. We will go do this for 1 week. Then we will go and give the patient rest, like go bed rest. discharge the patient. Then we will again call the patient after some interval, and we will go for interval cholecystectomy, which should be done after 3 to 6 weeks of, of this conservative treatment. Important point that HIDA scan is used to differentiate between acalculous cholecystitis and acalculous cholecystopathy. So acute calculus cholecystitis means again the same. Calculus means a stone is present. Acalculi means no stone is present. Else also we are getting that a gallbladder having stasis. The reason because when the surgeon was doing surgery, sometimes they chop the motor fibers, and due to the chop of motor fiber, there is motility of gallbladder has gone, so it cannot secrete out its secretions, which was stored. Okay, that we will use, like we will push isotopes in the gallbladder. Okay, and if there is a stone, no isotopes will be go inside, and if there is a motility problem, then also the stone, it will go, isotopes will be pushed inside the gallbladder but will not come back on its own. Thank you so much. This is my sample.